Welcome back to Ozarks Tonight. Recently, hospitals in the Southwest Missouri area announced they would be resuming elective procedures and visits that had been canceled due to COVID-19 precautions as to limit the number of people coming into their buildings. Some patients who had their procedures, visits, imaging services, or other care like physical or mental health therapy were cancer patients. And today we are discussing with the American Cancer Society Cancer Action Network a little more in detail what the impact was on cancer patients. Tim Freeman, the Missouri Grassroots Manager, is joining us now. Tim, thank you so much for being with us.
Thanks for having me. I appreciate the opportunity.
So, Tim, the American Cancer Society recently released a survey you conducted with cancer patients asking about how their appointments were impacted. How was cancer treatment, how has it been affected by COVID-19 and the precautions hospitals have taken in terms of delaying appointments or canceling them?
Yeah, we sent it out to a little over 3,000 cancer survivors and patients across the country. We had about 1,200 respondents in the first wave that we did. We have a second wave that we've done also to collect additional data. But as you mentioned, a lot of hospitals were having to make difficult decisions on having their facilities open and folks that they were able to see and procedures they were able to do. And cancer patients were not immune to that. You know, a lot of them saw delays or cancellations in their appointments. They were affected. Obviously, the pandemic has put some financial hardships on folks too, and so we had a lot of people share information about their ability to pay for their care and to go into those treatments based on, you know, if they lost their job or lost their healthcare coverage, and then have some concerns also moving forward about what being able to get care in the future is going to look like. So,
Tim, I want to just to give people at home an idea of some of the results of that survey. According to that survey, of those who've experienced in effect, nearly 1 in 4 reported a delay in care or treatment. Among those 1 in 4, the most common delays were for in-person provider appointments, 50%, delayed access to imaging services to determine if a patient's cancer had grown or returned, about 20%, and then access to supportive services, including physical therapy, mental health care as well, and access to surgical procedures. And then 27% of patients who are currently in active treatment reported a delay to their treatment, and more than 1 in 8, about 13%, had care delayed without knowledge of when it will be rescheduled. How does this impact someone's treatment, having to wait maybe 4 weeks, maybe even more than that?
Yeah, it's concerning. You know, each individual situation is going to be a little bit different. We're hoping that people are still staying in close contact with their cancer treatment teams, but to your point, it can have an effect. You know, whether it's the early screenings that people aren't going in for, you know, whether they're not going in for a mammogram or a colonoscopy, those types of things. Obviously, catching something early on is the best. Those preventative tests are the most effective to catching them early on. But as you said, people that are delaying those treatments, you know, depending on where they are in their treatment schedules and the severity of their cancer, it can have obviously a negative effect on the treatment. So we're hoping now that things are starting to get a little bit more back to normal, and hospitals are being able to take the precautions that they need to get people back in and get the coverage and the care that they need.
Tim, you talked about this a little bit earlier, that a lot of people are also experiencing financial stress trying to afford care right now, especially because some people might have lost their jobs or have their hours cut. How do we fix this? Are families not getting treatment because they don't have the money right now? Are they waiting even longer to schedule those appointments? Is there any assistance of some kind or relief for those who need treatment and medication?
It's a great question. I think it's multifaceted, as you mentioned. You know, I'm sure we all know people who have lost their job or been furloughed and are having to deal with a lot of different aspects that come along with that, their healthcare decisions being one of those. And as far as assistance goes, you know, there have been multiple stimulus packages that have been passed at the federal level. And we at ACS CAN have been working directly, and we've been involved in advocating for specific things to be included in those for people. And the most recent one, actually, that was passed by the House back on May 15th, I believe it was, there were several provisions in there that we were supportive of. There were subsidies that would help workers that have lost their job so that they can keep their employer-sponsored coverage, and there was some federal funding for expanding COVID-19 research and helping to restart research and clinical trials also that have been shut down due to the economic impact. So there have been several different versions of these stimulus bills that have come, and the House, as I mentioned, passed their version, and I know that's going to the Senate now, and they'll be working on those together. But for we at ACS and our volunteers, we continue to reach out to our elected officials so that they know the important provisions that we want to see in those bills. And there have been some good things that have come a part of those so far, and we hope that will continue in the future.
Yeah, Tim, you mentioned reaching out to legislators. I saw ACS is asking Roy Blunt to commit fully funding restarting of medical research and clinical trials in the next COVID-19 bill. How is he reacting? Have you talked to Senator Hawley as well? Are you also asking him? How are they reacting to this?
So we, ACS we are one organization. We're part of a larger coalition called the One Voice Against Cancer Coalition, and just last week we were supposed to do in-person lobby day in Washington D.C. through the OVAC coalition, and actually one of our volunteers from there in Springfield, Jerry Neville, who I know has been on the program here with me before, we weren't able to go obviously to Washington D.C. to meet with elected officials, but Jerry was on phone calls as part of that coalition, and I know he talked to staff in Senator Blunt's office, staff in Senator Hawley's office, staff in Congressman Long's office, as well as a couple other members of Congress from here in Missouri, and talked about the importance of increasing funding for research, as you mentioned, and some other aspects that we specifically were talking to them about. And each of them, Jerry and I talked last week after he had those calls, and he reported back that the calls went very well, and all the members understood the impacts that this pandemic is having on research and other aspects related to cancer, and they were all very sympathetic and very supportive.
All right, Tim Freeman with the American Cancer Society Cancer Action Network. Thank you so much for your time today, Tim.
Thank you, Jennifer. I appreciate it.
And as always, I will have links to the survey that we talked about here with Tim and ways to get connected with ACS on our website, ozarksfirst.com. We'll be right back with more right here on Ozarks Fox.